My name is Dr. Rajiv Agarwal. I am a gastrointestinal oncologist at Vanderbilt University Medical Center. And in addition, I'm also a palliative care physician at Vanderbilt. One of the most common questions that I receive is, what is palliative care? Palliative care is a discipline of medicine that really focuses on supporting patients and families who are coping with serious illness. And it does this by providing symptom management for physical symptoms, social symptoms, mental symptoms, existential symptoms, and spiritual symptoms, alongside navigating the journey of a serious illness with patients and families. In doing so, palliative care physicians can help patients and families know how to navigate uncertainty and how to prepare for prognosis and prepare for challenging situations that might arise throughout the disease trajectory. Oncology teams and palliative care teams go hand in hand. All information that you share with your palliative care team will be communicated with your oncologist, and together, the two teams work together to help you and your family. Palliative care does not replace cancer treatment, and it can be given alongside cancer treatment. Another question that often comes up is, how do I receive palliative care? Who initiates it? And this really can be determined by both the oncologist and your treating oncology team, and also by yourself and patients and families. And so if you feel like you would benefit from extra degrees of support, then you can ask your oncologist to speak to a palliative care physician. And when you meet with a palliative care physician, you can address a number of symptoms, both physical and non-physical, and might receive medications and non-pharmacologic interventions as well to help manage those symptoms throughout the cancer journey. One way to think about palliative care is it's an extra layer of support. So if you feel like you need more support in receiving cancer treatment and knowing where you need to be and how to process the cancer illness, the cancer treatment, the cancer prognosis, then speaking to a palliative care doctor could be helpful. The difference between palliative care and hospice care is that palliative care is based off of need, whereas hospice care is truly based off of prognosis. As a result, patients and families can seek palliative care alongside curative and goal-directed treatment based off of their level of need and the degree of palliative care and support that physicians and nurses can provide for patients and families will change depending on that need. Hospice care is an extension of palliative care. However, it is rooted in prognosis, and that's really a dedicated form of palliative care at the end of life. Oftentimes, oncologists may be able to provide excellent symptom management for patients who are undergoing cancer treatment. However, when the need for more aggressive symptom management occurs, they may refer those patients to a palliative care doctor who specializes in pain management, nausea management, and a number of other physical and non-physical symptoms. And this can be addressed and managed alongside receiving chemotherapy or any form of cancer treatment. One can receive palliative care both inpatient and also outpatient. In the outpatient setting, when you meet with a palliative care team, they'll review where you are in your cancer journey and help address symptoms. Palliative care can start at diagnosis and can continue throughout the cancer journey. When cancer treatment no longer works, palliative care physicians can truly help patients and families have conversations about their end-of-life wishes. In these conversations, we focus on what matters to you. We want to make sure that the care that we provide is in line with your personal values, your goals, and your treatment preferences. A typical palliative care appointment would look like the way that you would see any other doctor or nurse. You would visit them in a clinic setting, and oftentimes palliative care physicians and palliative care nurse practitioners will ask questions about your understanding of your illness and your understanding of what your oncologist may have told you. That's very important to have some framework by which we can work with you on managing your symptoms in the context of where you are in treating your cancer. In addition, palliative care doctors will then talk to you about those symptoms and try to really hone in on what exactly is causing those symptoms and the timing of those symptoms relative to your cancer treatment. One can receive palliative care both in the hospital if you are hospitalized for an acute medical problem, in which case your primary team may call for a palliative care consultation to address physical symptoms such as pain or nausea or vomiting, or to have a serious illness conversation with you and your family about where you are in the context of your illness. There is some overlap between palliative care specialists and pain specialists because both healthcare teams work on pain. The main difference is that a pain specialist is also specialized in knowing how to perform interventions to address the pain that are not drug-based. Palliative care doctors are experts in providing pain medications and knowing how to safely administer those medications and watching for side effects. Pain specialists can also perform interventions such as nerve blocks or joint injections when needed to help alleviate pain. Pain and cancer-related pain is a significant problem and symptom for all patients and families undergoing cancer treatment. What is important to recognize is that not all pain is physical pain. Pain truly is total pain, and that means physical, spiritual, existential, or emotional pain, because we know as oncologists and palliative care physicians that you are going through something that really affects all aspects of your life. For that reason, palliative care physicians recognize that by addressing pain, it may require some pain medications to address the physical aspects of pain, but it may also require a conversation about what are the sources of that pain and how can we alleviate some of those sources of pain for you in your life.